Did you know that a simple low-dose aspirin could play a powerful role in supporting heart health? In this video, I'll share how I use aspirin as part of a carefully balanced routine to help prevent artery clogging and support better blood flow. It's not a magic pill, but when used correctly and under proper medical guidance, aspirin can be a game changer. Stick around to learn the safe and smart way to use it. Today we will talk about how I use aspirin to unclog arteries. So before we start, make sure to hit the like button and subscribe to my channel. 1. Understanding the artery clogging process. Before diving into how aspirin can help unclog arteries, it is essential to understand what arterial clogging really means. Our arteries are blood vessels that carry oxygen-rich blood from the heart to the rest of the body. Over time, these arteries can become clogged due to the buildup of a substance called plaque. Plaque is primarily composed of cholesterol, fatty substances, calcium, fibrin, and cellular waste. This process, known as atherosclerosis, narrows the arteries and restricts blood flow, increasing the risk of heart attacks and strokes. The clogging doesn't happen overnight. It is often the result of years of poor dietary choices, lack of exercise, smoking, unmanaged blood pressure, and genetic factors. When plaque ruptures, it can cause blood clots to form, leading to sudden artery blockage. 2. The role of aspirin in artery health. Aspirin, acetylsalicylic acid, has been widely studied for its blood-thinning properties. Its main function is to inhibit the action of cyclooxygenase enzymes COX-1 and COX-2, which play a role in the production of prostaglandins and thromboxane, chemicals that promote inflammation, pain, and clot formation. By reducing thromboxane levels, aspirin makes platelets less sticky, thereby decreasing the likelihood of blood clot formation within narrowed arteries. For people with existing plaque, this is critical because a clot forming on top of a plaque can block the artery completely and lead to a heart attack or stroke. This is why doctors often prescribe low-dose aspirin, typically 75 to 100 mg daily, as a preventive measure, especially for individuals who have already experienced a cardiac event or are at high risk. 3. How I incorporated aspirin into my artery health routine. When I first learned that I had a moderate risk of artery blockage due to family history, slightly elevated cholesterol, and a sedentary lifestyle, I researched and consulted my doctor about preventive strategies. My doctor recommended starting a low-dose aspirin regimen. I began taking 81 milligrams of aspirin daily, usually after breakfast, to minimize stomach irritation. It's important to note that aspirin should always be taken under medical supervision because, although beneficial, it carries the risk of gastrointestinal bleeding and other side effects if misused. I also made sure to drink a full glass of water with the aspirin to help it pass smoothly through the digestive tract. Over time, I combined aspirin use with other natural artery-supporting practices, which I will explain further. The key here is that aspirin became a daily helper in preventing dangerous clot formation while I worked on addressing other lifestyle factors. 4. Supporting aspirin with dietary changes. Aspirin alone is not a magic solution for unclogging arteries. It must be paired with dietary improvements to achieve lasting benefits. I focused on adopting a heart-healthy diet rich in omega-3 fatty acids, fiber, antioxidants, and plant sterols. I incorporated fatty fish like salmon, chia seeds, flax seeds, and walnuts, all known to reduce LDL cholesterol and triglycerides. Additionally, I consumed more fruits and vegetables, especially berries, leafy greens, avocados, and tomatoes, which are packed with vitamins, minerals, and anti-inflammatory compounds. I avoided trans fats, processed foods, and excessive sugar. I'd also introduced a tablespoon of extra virgin olive oil daily, due to its proven ability to support artery flexibility and reduce inflammation. By pairing these dietary changes with aspirin, I addressed both the immediate clotting risk and the long-term plaque buildup problem. 5. Adding regular physical activity for maximum effect. Physical exercise became another cornerstone in my routine to complement aspirin therapy. I aimed for at least 30 minutes of moderate exercise 5 days a week, which included brisk walking, cycling, and swimming. Physical activity not only helps in weight management, but also improves circulation, lowers blood pressure, raises good HDL cholesterol, and reduces systemic inflammation, all factors contributing to healthier arteries. Movement encourages the arteries to remain flexible and less prone to injury or plaque buildup. More importantly, regular exercise naturally reduces blood clotting tendencies, which aligns perfectly with the aspirin's blood-thinning role. Together, these strategies improved my stamina, lowered my resting heart rate, and made me feel more energetic overall. The combination of aspirin, healthy diet, and regular exercise started to show tangible benefits in my cardiovascular markers over time. 6. Monitoring progress and adjusting aspirin use. A crucial part of using aspirin to support artery health is regular medical monitoring. I made it a habit to check in with my doctor every 3 to 6 months. We monitored my blood pressure, cholesterol levels, liver function, and signs of any potential side effects like stomach discomfort or minor bleeding. One essential test was the coronary artery calcium (CAC) scan, which provides a score indicating the extent of plaque buildup in the arteries. My doctor and I used this score as a benchmark to assess whether my regimen was working. Interestingly, after about 18 months, my cholesterol and triglyceride levels had significantly improved, and my blood pressure stabilized. This showed that aspirin was doing its job in clot prevention, while my diet and exercise were actively working to slow plaque progression. If I had experienced side effects or developed gastrointestinal bleeding, my doctor would have considered adjusting the dose or stopping aspirin altogether. 7. Supporting strategies to enhance aspirin's effect. In addition to aspirin, I included natural supplements and lifestyle habits that further support artery health. I started taking omega-3 fish oil capsules, which offer additional anti-clotting and anti-inflammatory benefits. I also used magnesium supplements to support vascular relaxation and blood pressure control. Drinking green tea became a daily habit because it is rich in catechins, powerful antioxidants that protect artery walls from oxidative damage. Managing stress played a critical role as well, since chronic stress can contribute to hypertension and artery constriction. I practiced meditation, deep breathing, and made sure I got enough restorative sleep each night. Another often overlooked step was staying well hydrated. Proper hydration helps maintain optimal blood viscosity and reduces the likelihood of clot formation. 8. The takeaway? Aspirin is a partner, not a standalone solution. Looking back, using aspirin to help unclog arteries has been a valuable part of my heart health strategy, but it's not a standalone solution. Aspirin mainly helps to prevent the catastrophic event of a blood clot forming on a narrowed artery, but it does not remove existing plaque. Real artery healing requires a multi-layered approach: dietary corrections, physical activity, stress management, supplements, and regular medical supervision. Aspirin is like a safety net that buys time while you work on reversing the deeper causes of atherosclerosis. It is also crucial to understand the risks. Aspirin can cause bleeding problems, especially in people over 70 or those with a history of ulcers. For me, the balance of benefits outweighed the risks because of my personal risk profile. But this is a decision that must always involve your doctor. Ultimately, aspirin has been a valuable tool in my ongoing journey to unclog arteries and safeguard my heart. If you like this video and would like to see more like it, please give it the thumbs up. Leave a comment and click the button to subscribe.